Good morning, doctors. Today I'm going to present another deep bite case with Damon Ultima. Okay, so the patient comes with her chief complaint of crowding, deep bite, and impaction. You think, where's the impaction? It's actually in the mandible. So the lower second premolar is impacted under the molars. And also there's a crossbite on the left side. So for the crowding, which arch do you think it's the more crowded part? Okay, it's a lower one because the second premolar is impacted and there is 17 millimeter of crowding. And the upper incisor is retroclined. The DI score is 21. So if you see a deep curve of speed, that indicates a space deficiency. And there's comes to the treatment point. When you see a crowding and a straight profile, you'll think first we should extract the premolars, right? So here comes our treatment plan 1. We will extract the upper first premolar and the impacted second premolars. Okay, but the patient, she doesn't want to have like surgery to extract the second premolar. So we come up with a second treatment plan, which is extract all first premolars. And we'll put the open core spring here to maintain the extraction space for the second premolar to erupt. And here comes an afterthought. We see that on the left side, the second molar has a large restoration, and it might will harm the teeth in the future. But considering that the third molar is still a little bit tiny, the morphology of the third molar is not well expected, so we didn't go for the third treatment plan. So we go to this second one. So in the first month, we bonded the upper arch with high torque bracket to procline the incisors and to prevent dumping when closing spaces and using a lot of class 2 elastic. So for the next month, we bond the lower arch and we added biturbo on the molars to prevent bracket wear because the bite is deep. And also we added open core spring. So this is how we treat the deep bite. First, we add anterior biturbos on the anterior teeth. Then we hook up early light shear elastic. So the horizontal force of this elastic will bring the patient to bite on the anterior biturbo, and we will have a new overjet. And also the vertical vector of this elastic will extrude the molar. So we can make sure that the patient will bite on the right open bite. And also we have to use the open pore spring to prevent the space of second molar being taken by the elastic. So 2 months later, we see that the molar did upright. So this means that the patient have occluded on the new overbite. Okay, then we will think about when is the timing when we switch from posterior biturbo to anterior biturbo. There are 2 thinking process. So the first one is when the anterior is crowding, we will use the posterior biturbo first because on this point, if you use anterior biturbo, the force will concentrate on the anterior teeth. So the anterior teeth is not easy to align. And second, it will harm the anterior teeth a lot because you may only bite on some points of the anterior teeth. And the second point is that when the upper teeth is still too upright, like this case, if you bond the anterior biturbo, the force will be behind the center of resistance. So this will make the teeth have a clockwise rotations. And it might be the teeth to have a fenestration if the force is too big. So we will bond the anterior biturbo after we flare out the anterior teeth. So in this way, the counterclockwise force will not lead to bone fenestration. Okay, so this is how we treat the deep bite. It looks perfectly right. When the space get closer, we switch from quail elastics to fox elastic. And on the 20th month, it seems like that we can debond, but life is not this easy. We see that something happens here. Our second molar is gone because the restoration is too big and the patient complained for the pain in the 21st month. So her mom says, Chris, maybe there's something perhaps you can do for me to bring the third molar into the front so I don't have to do any implants. So then when life throws you a lemon, you make it into a lemonade. We're still waiting for this teeth to erupt because it's on the verge of eruption. And 2 months later, if she come back, the molar hasn't erupted yet, we will use electrocautery to remove the extra gingiva and then bond on brackets. So we're turning it into a lemonade in the future. Let's wait for the update. I'll tell you everything in the future. So see you in 1 month. Thank you.